Yeah. No, I don't.
Okay.
I have a question.
As far as information, as far as the slides, what's your name again?
Lynette.
Lynette. Are those available on the website?
These slides aren't, but my card's on the back, and the brochure, if you pick up any brochure, you can reach me through the WAHA number, and I'd be glad to share them with you.
Okay, good. And a legislative question. The Princeton, there's a study through Princeton in collaboration with somebody else who did a big retrospective study of what are the chances that a huge majority of public supporting legislation, for instance, gun control, will get passed, as compared to what are the chances that corporate supported legislation will get passed. And this study showed that there is virtually zero chance of things that the public supports actually becoming law, and about 40% chance of corporate-backed legislation becoming law. So I say this because it was a fascinating study, and the implications are for campaign finance and lobbying, anti-corruption legislation. So the move to amend our Constitution to say that corporations are not people, money is not free speech, and that we should be able to regulate campaign financing, and the American Anti-Corruption Act to represent us, and a couple other versions, those are essential. It's like Lawrence Lessig said, if we don't fix democracy first, Bernie Sanders can give us a sane platform and he won't get anywhere. Or neither will Barack Obama or anybody, or bless your heart, our state legislature. So please pay attention to the big fixing democracy issues.
Thank you. I appreciate that. And it's like if you look at a lot of polls, the majority of people in the United States want a single-payer system. They understand what the problem is, and here again we go back to market economy.
Hi, my name is Robert. I have a question. Speaking to the issue of money and free speech, is it possible that if money is associated with free speech, that would be discrimination suit against anyone who doesn't have money? Is that a possible way to look at it?
It's a good argument.
Yeah, it is a good argument.
Nobody wants to speak to that.
It's true.
That's the absolute bottom
It's very
fact
true.
proof,
It's
and
very
that's
true.
why we're all really very concerned. And any other questions?
If Representative Linden could review when you're going to be giving the McCleary, where and when will you be giving that presentation?
That's next Saturday at the
I think Annette just talked a little bit about that. It's League of Women Voters next Saturday, 10 to 3, Northwood Hall. There is a charge to get in because they're paying for the facility and giving lunch. I'm going to give an update on McCleary, where we are with that and with the governor's work group. And then Ross McFarland from Climate Solutions is also going to come in and talk about climate change issues. Is that correct, Annette?
Yes, that's a very, very nice summary of some of the highlights of that meeting. And the League of Women Voters website is easy to find. The local league's website, if you want to register for that. Or just come and talk to me if you want. Thank you.
My name is Tom Dorsey, and I live up in North Plain, and I've just recently had a session with what they call a specialist on dermatology, and I'm slowly being drained by these outrageous co-payments. And I notice so far in this discussion, nobody has talked about this co-payment system. And this is my first experience with this, and why a doctor, just an ordinary doctor, would consider himself a specialist and require these horrendous co-payments every time you have a visit. And I'm over $300 more than what my insurance plan could ever cover this condition that I'm being treated for. And I'd like an explanation for that. Thank you.
Tom, the best thing for you to do is to make an appointment with Waha, bring your bills in, and your list of medications and everything that you're paying for now, and have a reevaluation. So this is what happens a lot. People think that by paying a lower premium per month, that they're going to win the game at Medicare. I hear it all the time, and when I see the ads start in open enrollment, I have to turn them off, the TV. I get so upset. They're selling you plans based on silver sneakers, based on some of the things that they're offering to try to get you to hook into their plans. I'm not saying their plan's bad. It might be the best for you, but it might not. There sometimes is a time in your health, the level of health care that you need, where it's better to pay a higher premium and go back to regular Medicare and buy a supplemental that covers much more. You can buy a supplemental that covers up to 100% of your copays, but it costs about $200 a month. Compared to regular, some of the Advantage plans are costing about $50 or maybe $60 a month. Now I hear some of them have gone way up, even higher than that. There are some Advantage plans that are even as expensive as straight Medicare with a supplemental. But you can get straight Medicare with a supplemental. Now, let me correct myself. The supplemental's about $200. You still have to pay the Medicare premium, $105 or whatever it is.
Yeah, Part D.
And then Part D prescription on top of that, which most prescription plans are only $40 or $50 a month. That still might be better for you than a plan where you have copays. It depends what your health needs are. If you start going to doctors a lot, start going in the hospital a lot, start accessing health care a lot, where everything is a copay, your copays can add up to more than a higher premium. That's what I'm trying to tell you. And so that's why every year having maybe a checkup, finding somebody to help you, that you can trust that's not trying to sell you their plan, that is impartial, is a really, really good idea. And again, you need to bring in your bills, what's costing you, your prescriptions, so that they can be put into the computer and figure out for you what's best. I suspect that there are programs that would help Tom way more than probably what he has at this point. When he probably first got that plan, that was the best for him at that point. He wasn't accessing much health care. As our health care changes, our needs change and our plan needs to change. And that's what people don't understand.
Thank you. I agree with Lynette perfectly, that her analysis is just right from what we understand. So that is one of the strengths of a single payer plan. It doesn't help Tom out right now, but if you have a statewide plan, there's an agreement, a negotiated agreement with providers on the cost for the next 2 years, the next 3 years, and it's the same for everybody in the state plan. This whole thing about trying to calculate, well, how much do I pay if I'm healthy 1 year? It would look like if I go to talk to my legislator, well, I pay this much for my health costs, my premiums and everything, my insurance that has medical in it. But then, of course, the next year if I get sick, I've got to remember to put in all my copays and my deductibles, and I hadn't thought about that. All of this goes into the calculation. One of the things a single payer can confidently argue is that if we have a publicly funded statewide plan, and there's advisory groups that work with the legislature on helping to find out how to negotiate with providers on what the best rates are for the next 2 years, what's a fair rate, then that's the same rate for everybody, and there's no hidden loopholes. The deductibles and the copays aren't there. They're out on the open surface, and everybody knows what they're going to pay for the next 2 years. One of the things that the exchange talks about, trying to make the best of an awkward situation, we'll say. Next year, here's part of maybe what we're up against. Next year, there are going to be 13 insurance companies that are going to be offering plans in the state of Washington. And because they have bronze plans, silver plans, gold plans, plans for young people, plans for old people, and plans for smokers, and plans for... They're proud to say they have 148 different products to offer us. So we have to go to people to find out, well, these 148 choices, what do I do? The talking point we say is freedom. The Americans love so much isn't freedom to pick an insurance company. It should be the freedom to pick any provider that's licensed in the state of Washington to go to. That's the freedom single payer is trying to offer. All licensed providers would be included, but not freedom to pick one of 148 insurance plans.
One other thing I wanted to also remind you about is that most insurance companies are making a profit, are for-profit organizations. There are very few that are non-profit. When you see all those expensive ads on TV, who's paying for those?
We are.
You know, the more they advertise, the more angry and corrupt I think they become. The more angry I get, and the more corrupt. It's wrong. Money is going into the wrong place instead of patient care, instead of programs like the ones I talked to you about today that don't cost a lot, that can totally change the healthcare system and make it much more efficient, much more quality driven, and save money at the same time. They don't want to pay for that. When we speak to some of the insurance companies, they don't want to put money into something like this. They're putting money into the other things that grab the volume, that grab all of you and get you to sign up. And so they're doing it, making their profit on volume. I'm sorry, but that's what's happening.
So, and the 148 are only the people that are signing up on the state plan. There's almost 400 individual entities out there that have multiple plans on top. And would it be too much to ask for one plan where everybody's covered and you don't have to fill out paperwork? If you've been to the local cardiologist, you see that there are 26 people running that financing office because of the multiple complexities of the billing. And that goes into your healthcare dollar. And every time I pay an insurance premium and I think, yeah, I'm taking my premium out over here, but I'm getting dividends in my portfolio.
Just one maybe closing comment. No one has mentioned the CMS, Medicare, Medicaid is funding a whole lot of demonstration projects across the country. And a lot of them are related to primary care and so on. And one more recent where they have a first year's data, they're doing, they selected like 50 practices. And they are doing essentially what we're talking about. They're going and making home visits. They're focusing on these chronically cared people who have a lot of chronic illness. And in 1 year, in this one program, they saved $20 million. So Affordable Care Act is doing something that we're not quite as aware of, and that is a lot. There might be hundreds of these all over the country that are being funded, some of which are funded through WAHA.
Right, absolutely. And at the state level as well. We have a care coordination program right now that I have about 220 patients in, but there's about 600, I think, in our area under it with different providers. That the state, again, they put some money into a plan to see what would happen if we had care coordinators assigned to high-risk patients. I wish I could quote the money it saved. In the first year demonstration, I believe it was something like $5 million or something. It's just astounding. They almost took that plan away. They were going to end it December 31st, and then that report came in saying what it had saved, and they decided to continue it through April. It's a struggle constantly for them to fund these programs, but when you look at the big picture, it doesn't cost that much to do some of these programs that can really help us save money. It's just where the emphasis is and how you make that happen. Of course, if we had a single-payer system that was not based on profit, it would take care of a lot of this. because then it would be based on quality initiatives and ways to cut costs.
Would the Washington single payer cover Medicare, Medigap?
I didn't see who's asking the question, so I can make eye contact. Oh, here we go, okay, yes. Yes, so the state plan as written can't cover any federal program, because feds, of course, have some, we can't change federal law, we only can work for our people. And then the last three, I think it's now section 19 of the bill, then says, well then, the legislature is authorized, once the plan is up, is authorized to ask to fold in Medicaid money. The legislature is authorized to fold in each of the various federal programs into our program. We have to get a waiver for each one of them. But the plan would be, for those of us who are over 65, I could then buy my supplemental plan from the WISP, and it would be probably 50%. I think the intention is all those who are buying a supplemental plan for Medicare would get it all through the WISP, and it'd be like 50% of what people who are buying a full plan for those under 65 would be half. And we get our supplemental also through the WISP. And I would be getting Medicare and the WISP. If that answers your question.
Are there more questions? I think we pretty well covered this, and I really appreciate your being here. How many people learned something new that they didn't already know? I feel that this has been worthwhile then, and I can't thank you enough, and I can't thank our panelists enough, because you've been truly enlightening, and that's big. That's very important, and thank you very much.
I'd like to thank all of you for the chance to come up to Bellingham and to be with you and listen to your questions. On the clipboard, the thing we think is the most important in the coming years, until we get to November 2020, is we need to work, we've learned, we need to work with small businesses, or businesses. So if you have any connections with folks who own a business and are trying to provide coverage for 3, 5, 10, 20 employees, if you would sign that sheet back there, the bright green one, we would really like to work with you and to be able to create dialogues with business people, small business people. The Exchange has not been able to work out an effective small business program at all. And that's what it looks like. Thank you. We would really like to know you, because that's the next big step, I think, is we want to have conversations with and win over small business people in the state of Washington. Please help us if you can.
Thank you.